Hello, I'm Dr. Tim McLaughlin. I'm an ophthalmologist who specializes in cataract and glaucoma surgery. And I work here at the Medical Center Clinic, and this is our ambulatory surgery center. We're located next to West Florida Hospital on North Davis Highway, just north of Interstate 10. The ambulatory surgery center is a two-story building that's right next to our pond. We have a natural spring-fed pond here on the campus. It's quite pretty, and our surgery center is right next to that. You will park out front near the pond, anywhere in that area, and there are actually assistants that will pick you up in our little carts and drive you here to the front. But if you can't see them or don't see any of them, you can just walk right up to the front door and come on in. You check in right in our main lobby. Off to the left is where our surgery center front doors are, and they're automatic sliding doors. You go in there and you're going to check in at the little iPad kiosk, and then one of the employees at the front desk will call you, and they'll have you verify your insurance information, make sure they've got your birth date, make sure they've got your name correct, etc. Then they'll have you take a seat in the waiting room, and after a period of time, the pre-op area where I'm standing now, the nurses who work here will call you back. They'll have you get comfortable here in the pre-op area, and then we'll get you ready for surgery. So this is our pre-op area at the ambulatory surgery center at Medical Center Clinic. So when patients come here for cataract surgery or glaucoma surgery to see me, they come through this area, and we have the patient lie down on one of these gurneys. We get them comfortable. Patients who are coming for surgery are not supposed to eat before they come. So our anesthesiologists prefer that your stomach be empty before surgery because that's safer when you're having surgery. We like our patients to use eye drops. Patients who are coming for cataract surgery, we like them to use an antibiotic and anti-inflammatory eye drop mixture starting the day before surgery. When patients come here for surgery to the surgery center, they can wear their regular street clothes, but we prefer that you wear something loose-fitting, maybe that buttons down, so that we can easily access your skin to put the EKG leads directly on your chest, etc. So you want loose-fitting clothes, comfortable, but you don't have to take your clothes off when we do the surgery. When we get you comfortable here in the pre-op area, our anesthesia team will come by and speak with you, including our anesthesiologist. And then they'll put an IV in, they'll access one of the veins, put a little IV in, and we can give you medication to help you relax before the surgery and during the surgery. Most people prefer to be in kind of a twilight state, just sedated for the surgery, not entirely awake. In general, we don't knock patients out, or we don't do general anesthesia for cataract surgery. Cataract surgery is generally a fairly quick procedure, maybe 15 minutes once the patient's comfortable and I'm ready to start actually operating. And so patients do really well just with this twilight anesthesia, as well as eye drops to numb the eye. It's usually only for more advanced, more complicated surgeries or glaucoma surgeries that we have to directly numb the eye by giving anesthetic through the lower eyelid and do what we call a block. We will slide you, we'll roll you on the bed that you're on back into the operating room, and after that you'll go to recovery, and you stay on the same bed the whole time. You don't have to transfer or move, makes it easy. So we're going to come right through these doors and go into the operating rooms. So we will roll you on this bed, and of course you stay in the same bed during the whole process through the operating room. We go into the operating room here and we'll get you situated. We have two operating rooms here that are completely dedicated to state-of-the-art eye surgery. And these are the two rooms that I work out of entirely. And I often go back and forth if I have multiple cases between these two operating rooms. So once the staff wheels you here into the operating room on this comfortable bed, we can adjust the angle of the bed. And I generally like you to come all the way up so your head's right at the very edge of this headrest. We put more drops in your eye to make sure your eye is comfortable, and then we use betadine to sterilize the surface of the eye. After that, we will put a drape over the eye to make sure that your eyelashes and your skin stay away from our clean ocular surface. And I typically will sit on the side of whichever eye I'm working on and start the procedure. During the procedure, if you feel any discomfort, we can put more eye drops to numb the surface of the eye. Or if you're feeling pressure or are anxious, we'll have our anesthesia member right here, right next to you, and they can give you more anesthetic to make sure that you're comfortable. But we don't like to knock you completely out during the surgery. We want you to be breathing on your own. We don't like to do general anesthesia if we can avoid it. During the procedure, we have monitors, such as this monitor at the end of the bed, and we will monitor your heart rate, your oxygenation, your blood pressure, all of those things during the surgery. The surgery is extremely safe. And we have the latest state-of-the-art equipment here with microscopes like this Zeiss microscope, excellent anesthesia machines, monitors, and the very best phacoemulsification cataract surgery machines. Our goal here at the Ambulatory Surgery Center of Medical Center Clinic is to make sure that you're comfortable throughout your cataract procedure or whatever eye surgery you're having here at the surgery center. Here in recovery, we'll make sure that your eye is not hurting. We can put more anesthetic drops in. Sometimes we'll have you take some Tylenol, make sure that you're warm, comfortable, get you something to drink. And once you're feeling awake and recovered after your procedure, we will often have a family member come back here and then you'll be discharged. We really want to make your stay here at the surgery center as comfortable as possible. We understand that eye surgery can be a stressful process. We want to make it as smooth and stress-free as possible. And hopefully this information and watching these videos will help you be prepared for your stay here at the surgery center.